fighting addiction medicine. And we're here with, there's 3 physicians here from ISIC, the International Academy of Science and Impact of Cannabis, to tell you what we're seeing in the emergency department, in our society, in the United States, and hopefully that the rest of the world learns from negative experiences.
And so I'll just a quick sub in because I meant to say this. The reason why we put this presentation in here as well is because I know many of you are in countries where you're being pushed to legalize as a medicine, legalize recreationally. So just to kind of learn from what's been happening in the U.S. and we have so many speakers in our network that talk about this. But I thought that it was a really great opportunity to have these doctors here who have really seen from the beginning what has happened up until now and can explain what they see every day.
So every day I come into work, I take care of marijuana poisoning. Every single shift. This is data from San Diego, 37 cases a day. Every shift I will take care of somebody who's in the emergency department for marijuana poisoning. And I could show you a bunch of data, but that's kind of boring. So I thought I'm going to take you along on a trip with me in a shift in the emergency department. So come along. And I usually come into the emergency department. I don't hear the sounds. Swipe my bag, rush in, and the very first thing I have to do is log into my computer. I'm a germaphobe, so I clean up my station. I was doing that even before COVID. And I log in, and this is what I see. And if you take a look at closer, I call it the sea of red. All the red are people who are waiting in the emergency department for many, many hours. Some of them are there for like 8 days, and those are people with mental health challenges. That's our biggest problem in the United States, is people really languishing in our emergency departments because of mental health issues, but part of that is from drugs as well. So the first thing that I do is I take those patients that are there for days and take a look at that. So come with me into one of the rooms. We had the whole little unit. This used to be our chest pain center for heart attacks, but we have so many drugs and mental health issues that we took out the heart attacks and made it just for psychiatric holds. And here's the first patient that I see, 37-year-old gentleman who's there now for 7 days waiting for psychiatric bed. He was actually earlier in Los Angeles in a psychiatric facility. He did better. He was given a bus pass to come to San Diego where we are, and to go see his mother. And he didn't make it there because on the bus he got his marijuana and went into psychosis again and went from the bus to the emergency room and didn't get very far. And that shows the first problem of the marijuana is that it's very addicting. And I'm just going to go, and if there's addiction, there's also withdrawal, and those are real symptoms. I'm going to go through 10 patients, 10 problems very quickly, condensing it all, so I have time for my colleagues as well. All right, so now I'm sitting behind the desk, charting on my notes, and I hear this horrible sound. I guess the sound isn't coming out.
I heard it.
You can't miss that sound. Good thing this is before lunchtime. But these are patients who are what we call scromiting. They're screaming and vomiting. It is a horrible disease. They're holding their pain. They're putting their fingers in their mouth, and they're feeling terrible. People have died from this, so it's not a joke. It's a real problem. It's cannabis hyperemesis syndrome, and these are patients who are using marijuana not for one day to get high or have a party. They're using regularly for years, and what's happening is their cannabinoid receptors and neuroreceptors are getting haywired, and they're giving you instead of saying, oh, if you use marijuana it gives you the munchies, they're getting the opposite effect, and they're miserable. There's a lot about that. So now the second problem is potency. And the potency, I can prescribe marijuana, right? I can prescribe THC that's FDA approved in the form of Marinol. If you her, she has cuts on her arms, and then I looked at her neck, and she's cutting on her neck. I actually had to admit her to our trauma doctors. She needed surgery because she was hurting herself, and the reason is she had voices in her head that told her that she needs to stab herself in order to save her boyfriend's life. Now this picture is not of my patient. This picture is a woman who was convicted of involuntary manslaughter after going on a date with her boyfriend. She took a hit of his bong and she went into cannabis-induced psychosis, stabbed her boyfriend 108 times, stabbed her dog, stabbed herself. The police came in, had to hit her 8 times before she finally dropped the knife, and she thought she was dead, and she saw her dead body, and she had to, and the voices were telling her, go, 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 and they're cheering her on in her head. And she's an audiologist, she's an educated college woman, she's used marijuana before, but this time it gave her a terrible psychosis episode to this, and this is a famous trial in California. And you think, oh, that's very strange, that doesn't happen. We see that on a regular basis. We see psychosis on a regular basis in our emergency departments across the United States, and I know around the world as well. All right, so that's problem number 3, mental health. How much of it is mental health? I think, Catherine, you're going to defer that, so I'm going to skip that. Suicide as well. This is Johnny Stack. His mother, Laura, speaks a lot about cannabis-associated suicide. He developed psychosis. He got his medical card when he was 18 years old, developed psychosis, thought the mob was after him, and jumped off a building. If we look at the drugs found in people who died by suicide under the age of 25 for the developing brain, the number 1 drug you see here is THC. More than alcohol, more than any other drug. All right, next patient. Holloway, and such a cute baby, right? This is my granddaughter. But the baby that I took care of was not so cute. She was laying unconscious, eyes rolling in her head. She had encephalopathy. The last time I did a presentation like this, when the doctor said, yes, I put a baby like that on a ventilator. Children are getting into their parents' marijuana products. We've done studies on this, and it shows the number 1 source they get it is from their mom. The number 2 is from their dad. And there's been a 13-fold increase in the number of children. These babies are not addicted. They do not have a substance disorder. They do not need recovery. They need their parents to lock away their marijuana like you lock away, in America, your guns. But these children are getting into these candies. They look like candies, and babies put everything in their mouth, and they're not laughing and giggling. They are getting encephalopathic and getting in the ICU on a ventilator, and sometimes with very serious outcomes. These are the kind of products, like, why do we need these things? We tried to pass a ban on candies in California, but it didn't pass. And these are the candies, Weedos that look like Cheetos, and things like that. All right. Co-trauma. So I work in a trauma center, and people come into with serious accidents, and here they're bringing us a patient who was in a car accident. So people know the message is out there not to drink and drive. The message is not out there not to be high and drive. And alcohol plus cannabis together is additive. So even if you have the legal limit of alcohol and you add to that marijuana, you are now impaired. So the patient we have here, he sadly did not make it. He died. But I took care of also the person who hit him, which is a 25-year-old boy. He did not die, but he'll never have his life the same again because he killed someone with very little alcohol and cannabis, and he was impaired. So that's problem number 5. We're going to hear more about that with Dr. Kramer. The next patient, this is Andrew. I come out of the trauma center and I get handed an EKG. On the EKG, it shows atrial fibrillation, your heart's quivering, and we could take care of that. That's easy, for emergency physician to take care of atrial fibrillation. We can fix it with medication. We gave this guy a shot, but it's important to go okay, why did this happen? So you can have prevention, right? We think of prevention in the emergency department, and sometimes the answer why is right 300% increased risk for coronary artery disease, for heart attacks, and for strokes associated with marijuana. The American Heart Association has clear guidance that this is not beneficial for your heart. Now, word isn't out there. People aren't hearing that. None of my patients have heard that, and they say, oh, I've never heard that before. The lungs also, cannabis is not good for your lungs. Smoking anything is not good for your lungs. It has the same carcinogens. And they've done interesting studies to look at secondhand smoke. And secondhand smoke, what do you think is worse? A cannabis joint or a cigarette? What is worse for secondhand smoke? And actually, a marijuana cigarette is 3.5 times worse than a Marlboro cigarette for secondhand smoke. So that's that. Cancer, there's association with testicular cancer, 2.5-fold increase, and you can see the little sperms, a healthy little sperm and little sperm on smoking cannabis doesn't swim as good and has mutations. Sometimes if there's a very sick patient, we're waiting in an empty room, we hear that the ambulance is going to bring us a sick patient, and the next patient is a gentleman with internal bleeding, low blood pressure, internal bleeding. How is marijuana associated with internal bleeding? So this patient tells me that, he's been in the hospital already. This is time number 3 times in the hospital. Blood transfusions, endoscopy, why is he bleeding? And he says, oh yeah, I've used marijuana forever, it's never been a problem. But he's never been on blood thinners before, medication. He has heart stents. So now he's taking medications that interact with his cannabis use, and that's causing him to have more bleeding. Blood thinners and cannabis makes your blood more thin. So the problem number 7 here is drug interactions. So there are, if you go to drugs.com, if there's one thing you get out of my lecture, check for your medicines. Go to drugs.com, click on the drug interaction checker, put in your blood pressure medicine, lisinopril, add to it cannabis, or add to it cannabidiol, CBD, and you could read for yourself. This is what I tell my patients, just read for yourself. Now, you don't have to listen to me. You look at drugs.com, and you decide if you really want to take cannabis or cannabidiol or CBD. I know there's shops all over here. None of them show you to go to drugs.com if you're taking other medications. All right. So here they're calling me to another room. I have like an 8-hour shifts, and I'm like 4,000 steps. So come with me to my next patient here. And here's a guy with a seizure. So the nurses are calling me. The guy is having a seizure. Again, we can fix that, stop the seizure. But somehow the public hears, oh, it's good for seizures. It's good for seizures. And politicians even wrote that into law. You could use marijuana if you have seizures. But the FDA shows you that it decreases your seizure threshold. You have more seizures if you take marijuana, and then you forget to take your real seizure medicines when you're taking marijuana. For seizures, so that's problem number 8. It's misleading health claims. We were just talking about research on recovery, and very little research. I was amazed that this was published. Free weed could help people relieve the opioid crisis. Okay? This was the headlines, and if you looked at it, and this was published in a peer-reviewed journal, harm reduction journal, 10 patients who had a cannabis use disorder who were given free weed, so of course they were happy. And the people giving them probably also had a cannabis use disorder. And from that, you said, we should give everybody free weed. Pretty impressive. So misleading health plans, misleading on seizures. There are a subset of babies who have Dravet syndrome, very unusual seizures. They're having 100 seizures a day. They get pure CBD oil that's available by prescription, and that helps their seizures. These babies are not smoking weed, okay? And American Epilepsy Society says do not use cannabis, marijuana to treat seizures. For pain, for sleep, for nausea, all these health claims, and none of these studies that are done show that with high potency marijuana, and in the United States, everything is high potency. You can't find low potency marijuana in the United States. And then going quickly to kind of get through what is behind my next patient here. The next patient is an older gentleman who's not acting right. He's confused. He was a family reunion, and he told his grandson, I'm taking all these medications and I can't sleep. So the grandson said, oh, try this, Grandpa. And he gave him a brownie, and he slept. He slept so good that he didn't wake up, and he came to the emergency department, and there's no antidote. We can't fix it. We can treat symptoms. He had to wait several days in the hospital till it came out of the body. There's no reversal for that. His liver doesn't work. So if your liver doesn't work, marijuana is metabolized in the liver, and it's going to last a lot longer in that. So again, we have to also teach our young people not to give this to grandma and grandpa. And there have been in California over 1,800% increase in older people over the age of 65 because of marijuana who come into the emergency department. All right, so that's problem number one, is product integrity. And there's an alert by the CDC that says if you have a bone marrow transplant, if you're immunocompromised, you should not be using smoke products of marijuana. Why? Because almost 100% of them have fungal infection, E. coli, aspergillus. They did a study, they went to 20 legal medical dispensaries in California. All of them, 100% of them, had these side effects. So people have cancer and they say, oh, shouldn't I use marijuana? Isn't that better than those opioid medications that are so addicting? And I'll say, no. If you're a cancer patient and you're immunocompromised, those opioid medicines, that's what's for you. And don't be smoking something that can give you these kind of infections. So last patient of the day is a 21-year-old girl who has a headache because she was in a fight and she's there with her baby. And she uses marijuana, so now there's two people affected by that, her and the baby. Most patients, when I talk to them about marijuana, they're interested. They want to hear about it. She wasn't. And she said, I've been using it since I was 16 years old. I'm intelligent. It's not a problem. And she didn't realize that she's here getting into these problems and is homeless and she has problems. Sometimes people don't connect it. And that's problem number 10, is a growing brain. I think you all are very familiar about that. Not good for anybody. More chance of addiction on the growing brain than an adult. And that's why, Surgeon General has an advisory, just like we have for tobacco, an advisory against using marijuana on the growing brain. All right, and this is my favorite part of the day because after 10 hours in the emergency department, 30 patients, 4,000 steps, it's good to come back to the computer, close it up,